Good morning. Today we're going to talk about peptic ulcer disease, or ulcers as people commonly think of them. I did do a chapter on ulcer disease, and it's very important. And we did encounter a lot of ulcers in the hospital. They may be bleeding, and that's commonly where we got involved to try and stop the bleeding and deal with the problem, and also diagnose the problem. As it turns out, there's been a big advance in our understanding of peptic ulcer disease, or ulcers, and most people commonly think that it has to do with too much acid in the stomach, but that is not the usual cause. That is a rare disorder when that happens, caused by a rare tumor. The most common cause of peptic ulcer disease, or ulcers, is actually aspirin or drugs like ibuprofen. But the big advance also was the understanding that there's a bacteria called Helicobacter pylori. It used to be called Campylobacter, but when I was in training, we didn't really understand the role that this bacteria was playing. And it really was not well elucidated until 2005 or before then, when two doctors, Dr. Barry Marshall and Dr. Warren, went ahead and showed that this bacteria can cause GI symptoms and problems because they inoculated themselves. So anyway, they got the Nobel Prize of Medicine in 2005, but most people are not aware of that. So at any rate, peptic ulcer disease is usually caused by aspirin or ibuprofen type drugs, or Helicobacter pylori, or a combination thereof. I was discovering in the hospital that a lot of patients who had ulcers had a history of ulcers but were never checked for Helicobacter pylori. So I started to include in my questionnaire the question, have you ever had ulcer disease? Because if they had Helicobacter pylori, we wanted to get rid of that bacteria and get rid of their ulcer disease, if possible, before they got put on aspirin or were taking ibuprofen or Aleve or medications like that, so that they wouldn't end up in the hospital with bleeding ulcers. It's important to note that about half of people that have bleeding ulcers have no abdominal pain, so there might not be any type of warning symptoms. A lot of people will take aspirin or aspirin compounds and not be aware that they're taking aspirin. There are coated aspirin products as well, but they also can produce ulcers. They may be less discomfort when you initially take them, but they can still cause peptic ulcer disease. A number of medications are might include aspirin in their formation. Or their manufacturers. So you have to be aware of that. In terms of drugs like ibuprofen, these are called non-steroidal anti-inflammatory drugs, or NSAIDs for short. And they include a large number of medications, such as Aleve. The other name for that is naproxen. There's Feldene, that's a trade name for piroxicam. There's Voltaren, and many others. So it's important to recognize that. Advil is another name for ibuprofen. So a lot of drugs have a generic name, and some of them are still under patent, have a brand name as well. A good example is Advil. So Advil is a brand name, ibuprofen is the generic name. So you have to look these drugs up. if you're on them or anticipate being on them, to see really what the situation is. Now, another important item that should be mentioned is cancer of the stomach. So a number of patients who have cancer of the stomach, this cancer may cause ulceration in the stomach, and it may look like peptic ulcer disease or simple ulcers. And the medications we have now are powerful enough to heal up cancer-associated ulcers. So it becomes important for gastroenterologists to follow these along. In other words, after the patient's been on treatment to heal these ulcers, you're usually talking about 8 weeks or so. They should be healed, perhaps 12 weeks. You want to take another look with the endoscope to make sure they're healed. There's nothing that looks like cancer. You may want to biopsy the ulcer site just to make sure there's no cancer. And if the patient had Helicobacter pylori, then you can biopsy again to see if it's been eliminated. So ways to check for Helicobacter pylori are there's certainly upper scope with biopsy through the channel in the endoscope. There's also breath testing, and there's stool testing. There's also blood testing, but it's not as reliable. And so when you do blood testing, the possibility of it picking up the bacteria infection is anywhere from 80 to some 90 some odd percent, depending upon the method that's used. So it's not all that reliable, and if it's negative, it doesn't completely rule it out because you don't know if you were in that 20% of one of the tests that didn't pick it up. And once it's positive, the blood test remains positive, so you can't use it to see if you got rid of the bacteria or not. And if a patient's been treated in the past and they got rid of the bacteria, but their serology or blood test is still positive, it doesn't really tell you for sure what the current status of the Helicobacter pylori infection is. So generally, the blood test for Helicobacter pylori has fallen out of favor, not used much anymore. So with that, I'm going to go ahead and conclude the talk on peptic ulcer disease.